contraception and some of the risks and benefits of the various methods. Before we get too far along, we want to introduce ourselves. So my name is Dr. Silka Patel. I'm an OBGYN in academic practice in Baltimore, Maryland. And here with me is one of my colleagues.
Hi, I'm Dr. Tara Abraham. I'm in private practice. I'm an OBGYN in Washington, D.C. And so the way I always like to start out this talk with my patients is to first direct them to good sources to look up information. So a couple of sites I direct people to are the CDC or bedsider.org or Power to Decide. Silka, would you mind pulling up one of like the chart from the CDC so we can sort of go through some options? I think, whenever we talk about, thank you. Whenever we talk about contraception, it's not a one-size-fits-all sort of situation. So, some methods work for some people, other methods work better for other people. I like to break it down into hormonal versus non-hormonal contraceptive options. So on this chart, you can see Dr. Patel is circling some of the hormonal contraceptive options, such as the implant, the IUD, the Depo-Provera shot, the pills, patches, and rings. And then, of course, as Dr. Patel will talk about, there are other methods that are non-hormonal, such as the Paragard or barrier methods, as well as natural family planning methods.
Yeah. Often people think about birth control and they all of a sudden assume that they all have hormones in it. But as you can see, all the options that are not circled are non-hormonal options. Those include the permanent options, so tubal ligation, as well as vasectomy, which we'll talk a little bit more about in detail in this talk. There's a male condom, the diaphragm and the sponge, which many women tend to favor less at this point in time, but still are very good options for them. And again, don't have any hormones involved, along with a female condom and spermicide. The two that I have not mentioned yet is the fertility awareness or the natural family planning method and the withdrawal method. And some people think that those two are the exact same thing, and they're really not. So when you're doing natural family planning, there are certain criteria that you actually need to have in place. So the first is you have to have regular cycles. You have to be aware of when your regular cycles are, and you have to be willing to hold or not have sex during those times of highest fertility. And so that really does take a little bit of planning. It takes some coordination. There's different apps that you can use. There's actually different systems that you can use to help keep track of that so that you and your partner can sort of be on the same page. The withdrawal method is actually exactly what it is. It's just withdrawal before ejaculation. People who practice the withdrawal method are not necessarily monitoring when they're the most fertile or not. And so it is really important that there is a very big distinction between the two. And although they're on the same kind of efficacy level, if you're doing true natural family planning, your ability to not get pregnant can be much higher than if you're just using a withdrawal method, regardless of the time of ovulation. So, this is a really good example of how it is so important to talk to your OBGYN about what kind of method you're thinking about and be very specific when you're using language about what you're trying to do to prevent getting pregnant. So they may either understand how at risk you might be for getting pregnant, and then as well kind of direct you on how to make whatever method you're doing be the most effective for you.
Absolutely. So, people in general are very familiar with birth control pills. Whenever we talk about contraception, I think pills is one of the first things that come to mind. And so of the hormonal methods, birth control pills are estrogen, progesterone, or they're progesterone only pills. But some options you might not know as much about are things like the progesterone releasing IUDs, as well as, or the non-hormonal IUDs, such as the copper IUD. And in general, with the progesterone releasing IUDs, they're good for anywhere from, there's multiple different ones. They're good for anywhere from 3 to 7 years, and they are inserted in the office. And they're not just for women who have had children before. So I did say earlier that they're good for 3 to 7 years. They actually come in different sizes as well. And, I think they're a great method for birth control. The efficacy is over 99%. And it's a method that I like talking about because it's a method where you don't have to think about taking something every day. So if you don't think you're good at taking a pill every day, then I think this is one of the really good options to consider.
You know, if you ask OBGYNs nationally what birth control method they actually use, we've done studies, and the majority of obstetrician gynecologists actually use some form of an IUD as your contraception of choice. So we're not saying that this is the best method by any means, but in terms of, you know, you have people who have seen all the risks and benefits of all the options and they're choosing it. So I know for many of you, it seems like a kind of a scary option or a different option or a new option. You know, you have people who are very well versed who feel very comfortable using it for themselves. So hopefully that'll give you some comfort. Another one I like to talk about a lot, Tara, with my patients that they may or may not know is something called the Implanon. It's actually a progesterone releasing device, just like one of the IUDs is progesterone releasing. You know, the other one is not, but one of them is. This one goes by the name Implanon. Some people may have heard the name Implanon. It's very similar to that. It is not, it's kind of in that same family of Norplant that some people may have heard from like ages ago, but does not have the same problems that the Norplant is. So just, you know, if you've heard of Norplant, if you have a mom who's talked to you about Norplant and how bad it was, just really be aware that this is, although very similar in where it is, has a very different profile. So the Implanon, like we were talking about, actually goes in your arm. So you kind of put it up your arm, it goes in this kind of bottom part of your arm right here. You can feel it, it's just under your skin, but if somebody like is touching you or holding you, or, you know, if you're at the beach or if you're like laying back, you know, in your bikini, no one's gonna see that you have an Implanon in place. It's good for up to 3 years, which is fantastic. And we'll talk about this later, that because it's progesterone only, it has some of the benefits of the progesterone only options as well. One of the things I really like about it is some women, especially those who may just be starting out being sexually active, or some women who are just really nervous about having something inside your uterus. You know, maybe that makes you uncomfortable, or you're a little scared about not being able to tell for sure if something is there. They really seem to like the Implanon because not only is it in your arm, which seems a little less scary, they can kind of feel for us. They sort of know all the time that they're protected.
Right.
And you don't have that discomfort of putting it in. I do want to let you know that it is done in the office. So this is not something you have to go to the operating room to get done. It is a very small little injection that gets placed, and it also gets removed in the office very, very easily. So it is actually one of my favorite ones to talk about because I think people are really surprised with how easy it is to use and how beneficial it can be.
Yeah, and I will add actually with these options, the IUDs and Implanon, because you've had one place doesn't mean that you can't have it again. So you might love your IUD and have it for 5 years or 7, you know, and then have it replaced for another 5 years. So, or have your Implanon for 3 years and have it replaced for another Implanon if you truly enjoy that method. There are a couple other options that, you know, you might not know very much about as well, also known as there are two options, the ring and the patch. So these are options, you know, unlike the IUD and the Implanon, which are good for years, and the OCPs, which you take on a daily basis, the ring is good on about monthly basis. So it's something you place vaginally, and you do remove it every month and have a period if you want to, or you can use it continuously and not have a period. But you do have to replace it and remember to replace it on a monthly basis. The patch is a small patch where you place on various sites in your body, and you do have to remember to replace those on a weekly basis. Both of these methods contain both estrogen and progesterone as hormones. Yeah. So now that we've, you know, described some of the methods that keep you from getting pregnant, you know, there are other benefits other than keeping you from getting pregnant. So Silka, do you want to start talking about some of those things?
Yeah, I think one of the best benefits that we sort of hear about and people are a little kind of shy about or unsure about is this idea of not having to have a period. And so the progesterone only methods specifically are the ones that we talk a lot about when we talk about not having a period. And the way these work is because it's only one hormone, progesterone, it thins out the inside lining of the uterus. So over the course of several months, you might have some irregular bleeding and spotting, but after about 3 to 4 months, most women either have no periods at all or have very light bleeding because the inside lining has been thinned out so much. And so when we're thinking about the birth control that really kind of comes to mind for this, are progesterone releasing IUDs are the ones that we think about. The Implanon, which is a little device in your arm that we talked about. And there's also a pill form called the progesterone only pill. So people call it the mini pill. You may have, if those of you who have had children who might have been breastfeeding, we often offer this as a kind of an alternative to the combination pill for those patients. You may have heard about it in that conversation. But all of these methods, because they're only progesterone, do have this added benefit, which is kind of fantastic. Now, I often hear, like, is it really safe for me not to have a period? Like, that seems like unsafe. It seems very natural for me to have a period. And I will tell you that, if without any hormones, you're not having a period on a regular basis, that is not safe. Okay, so that is something that you definitely need to talk to a doctor about, talk to your primary care doctor about, find a gynecologist, talk to them about. But if you're on birth control and you're not having a period, it's actually very, very safe. Because like I mentioned, you're not building up a lining inside for all the months that you didn't have a period. In fact, you're actually having a very, very thin lining inside. And the reason you're not having a period is you have nothing to shed. So, rest assured that you can enjoy this benefit of not having your period and not have to really worry about any downsides of it.
So other than no, lighter periods or no periods at all, birth control pills, the ring, can also confer some other benefits, such as, some people might take it or start these things because of hormonal control for, acne or excess hair growth. But also these have benefits in terms of decreasing your cancer risk for certain cancers, such as ovarian cancer, endometrial cancer, as well as colorectal cancer. So one of the things that people always ask is, won't hormonal contraception increase my breast cancer risk? And the short answer is no, it does not. A lot of studies have shown that it does not increase your risk for breast cancer when taking it, during the premenopausal era.
Right, especially with the combination ones that we were talking about. The combination pills, patch, and ring definitely don't seem to increase that risk at all.
And so, Silka, do you want to talk about a little bit about like some of the other, more permanent options for contraception?
Yeah, so one of my favorite ones to talk about actually is vasectomy. And you might be like, well, why is a gynecologist talking about the vasectomy? And the reason is because, part of my job is make sure to find the best option for you. And the best option for you may also include the best option for you and your partner as a team, depending on your personal circumstance. And so we always want to bring up vasectomy because a lot of women don't know as much about it, to be honest, because it's not something happening to them. So the vasectomy, when you compare it to tubal sterilization for women, is much less risky. It does not require general anesthesia. So most options for tubal sterilization in women require general anesthesia, whereas a vasectomy is local anesthesia. So it's like lidocaine, like what you get when you have like a tooth extracted or something, a dental procedure done. It's done in the office instead of in the operating room. So that also is really important for some people, depending on cost and insurance and that sort of thing, can make a big deal. And also because the testicles are outside versus the tubes that are inside the abdomen, the actual procedure itself incurs less risk to other areas. So whenever we do, for instance, a tubal ligation where we have to go in laparoscopically or through small incisions, we not only have the risk of general anesthesia, but we also have the risk of laparoscopy, which includes the risk of damage to nearby structures like the bowel and the bladder and the intestines, whereas a vasectomy does not have those risks associated. So really by nature, it's a much less risky procedure and is something to consider having a discussion with your partner about in terms of a birth control method that is permanent and could be really beneficial for you as a team.
Right.
You want to talk about, go ahead.
I was going to say exactly along those lines, a tubal ligation can be done via minimally invasive procedures. So it's usually done laparoscopically, using cameras and small incisions in your belly. And you're right, a vasectomy can be a great option, especially for women who have maybe had a lot of procedures before on their abdomen, a lot of surgeries, and it might be difficult to do a tubal ligation, but there are a lot of benefits in terms of a tubal ligation for sterilization. So using it as birth control method. Self-injectomy has been found to decrease the risk for ovarian cancer. So a lot of studies have been performed that showed that some of the certain types of ovarian cancers develop at the fibroated end of the fallopian tubes. And so by taking out both fallopian tubes, so self-injectomy is the removal of the whole fallopian tube, not just taking a segment of it, which is what we used to do, but taking the whole fallopian tube. This can decrease your risk for certain ovarian cancers in the future.
And that can be really important because, again, this is a conversation. And so you really do need to have that conversation about other family history that you guys might have or other concerns you might have when you're thinking about what option might be the most beneficial for you. Because if this is something that you're worried about, then it may make sense to consider tubal ligation if you're ready for a permanent procedure.
Right. And I think, in general, going with our theme where, there are so many different options for birth control, and it's not a one size fits all, right? So, so one of the things I do hear a lot about, is, well, is birth control going to make me gain weight?
I think this is such a big concern, especially for women. So many of us are trying so hard to maintain a healthy lifestyle and maintain a healthy weight, kind of all the other benefits that are associated with it. And we really don't want our birth control foiling that. So it is really important to know that when you look at large studies, when you look at large groups of women, and you look at them, whether they are on contraception that's hormonal or not hormonal, or no contraception at all, there really doesn't seem to be any association between birth control and increasing your weight kind of as a general whole. Now, that being said, there is one, however, that we have seen data that causes weight gain, and that's a Depo-Provera injection. So that's that injection that we were talking about where you get into your arm. It's usually once every 3 months at the doctor's office, and it is progesterone only, but it's a different dose and different type of progesterone than some of the other ones that we've discussed. And with that one specifically, we have seen data that says women on average gain between 5 to 10 pounds with this one per year. So, again, it's not all women, it's an average. You might be different. So if there's other reasons that compel you to try it, definitely have that conversation with your gynecologist. But just be aware, this is the one that people think about when they think about, is birth control going to cause me to gain weight? It's 5 to 10. Now we say this, but every single person is different, right? So these are large studies that we're looking at. We're averaging it out over people, but you might be very different and your body might react to the hormones very differently. So, if you're on a method and you're noticing some fluctuations, talk to your gynecologist, see if maybe you can pinpoint what it is that's causing that weight change. Remember that if you are on a progesterone only option or a pill option, there's lots of different formulations for these things. So it's not just like a one kind of pill is one kind of pill and that pill is the same as another pill, or that there's only one type of progesterone releasing IUD. And so you might need to just change it a little bit and try something new. And that might be all you need to do in order to find a method that works better in that same kind of category of methods. And this kind of goes to the one thing that we always talk about is having patience. Okay. I know it is really, really hard when you feel like you're not getting what you want or that you're having a side effect that you're not really excited about with the contraception option. Most of us will say you have to at least give it 2 to 3 months to really figure out what a birth control is going to do for you. Because if you think about it, you're only going through your cycle every 28 to 34 days. And so if you're going to give something at least, 2 or 3 tries to see if it's going to do what you want it to do, you really need to wait that amount of time to see a benefit or not. So the long and short of it is no, it's not supposed to cause weight gain for most people, aside from the Depo-Provera. But again, everyone's a little bit different. Tara, the other thing I hear a lot about and people are really concerned about, especially younger patients who are thinking about having children in the future, is if I use birth control pills, is it going to make it harder to get pregnant when I want to get pregnant?
Absolutely. I hear that all the time, actually. And, I always circle back to, why did, if you're on birth control pills or a form of hormonal contraception, what prompted you to start that, right? So, what was it that made you start birth control pills? Was it, for contraception solely? So did you have regular cycles and were you just taking it for contraception, or were you taking it because you had, as we mentioned before, acne and using it to control acne, or were you taking it because you started off having, very erratic, irregular cycles and you use it as a way to control your cycles. That may be like, you may go 2 months between cycles or 4 months between cycles, and it was very all over the place, and, or if you were ever told you had something called endometriosis, for instance, and you had painful periods, these factors, so like, having very erratic or irregular cycles and endometriosis can affect your fertility just in general. So if you started taking birth control pills to control the symptoms of those, diseases or diagnoses, per se, then sure, your fertility might be affected, but not because of the birth control pill, or hormonal contraception, but because you had these pre-existing sort of conditions. So in short, birth control doesn't necessarily make it harder to get pregnant. It just depends on how your cycles were before you started contraception, and how, that can affect your, fertility. The other thing I would just mention to people is, when are you starting to have that conversation with your doctor about, planning to get pregnant? So, delaying fertility is obviously a factor. So, being on birth control for a long time isn't necessarily, but when you decide to actually start considering starting a family, is. So, delaying fertility does affect or make it harder for you to get pregnant as well.
Charlie, this has been so much fun sitting here chatting about something that I really love talking about. I know you do too, in terms of really like finding the method that's going to make our patients the happiest and really achieve their goals. Because, each of our patients has very different goals for what they want in terms of their future fertility, their current fertility, but not only that, just how their periods are, what other medical problems they have, and what really fits their lifestyle. And I know you, like me, really, really enjoy getting to know your patients to be able to figure out exactly which of the multitude of options we've talked about today would work well for them.
Absolutely. I encourage you, and we encourage you to take a look at the websites we mentioned before, bedsider.org and Particide, as well as the CDC website, and talk to your doctor about whether or not you have certain things in your history or family history that might make certain options better for you. So thanks for listening. All right.
It was really great talking to you guys. Take care.
Take care.